Good afternoon, everyone, and happy Halloween. Well, here we are in the fall with the cool air and the changing of the leaves. This is my favorite time of the year, and so but I'm not a trick or treater. Those days are gone, but I still enjoy the holiday. Today, we are joined by Stephanie Clapper of the Maryland Citizens Health Initiative. Hi, Stephanie, how are you?
Good. How are you, Sandy?
I'll tell you, Stephanie and I are working together on a
Mm-hmm.
project. I'm having to deal with the new initiative on the health plan and how to get more Maryland low-income people signed up. So I'm
Mm-hmm.
really looking forward to us working together. And we're going to talk about that a little bit in a few minutes. But before we do that, before we get talking to Stephanie, I want to give an update on the annual IRS liaison meeting that we had last week. At our meeting in Towson, we enjoyed presentations from the field collections, taxpayer advocacy, and offshore compliance updates. And I just want to highlight a couple of the items that were brought to our attention. The first thing is the data security. Once again, they reminded us that is every person, when you renew your PTIN this year, you need to have a written data security plan in place. This is a question that they're going to be asked when you renew your PTIN. So you want to make sure that you have it prepared, it is written, and that it is in file in your office. It just cannot be up in your head and you've been thinking about it, because data security is a really high initiative that the IRS is really, really stressing this year. So make sure you have that in place before you renew your PTIN, because that is a question that is going to be asked during that renewal process. Also, we had Veronica Tinsley of the collection section, and she was talking about what they're going to be focusing on in the collections area. So apparently, their focus this for the next few months is going to be employment taxes. So the thing is, the reason why they're doing this is because they're seeing repeat offenders. And what does that mean? When people are not paying their payroll taxes, they get in compliance, and then like a year later, they're back out of compliance. And so this is becoming a real problem. So what their initiative is to really focus on the employment taxes, as well as educating the business owner to how to stay in compliance. So this is a real focus that they're dealing with. And so I think this is a really important thing, and I applaud the IRS for doing this. Also, Mrs. Tinsley said they were looking at the marijuana businesses, focusing on business deductions and how they're being verified, and that people are not mixing the income from marijuana business with another business they may own. So if you're into that area and you have clients in that area, just be aware of that. And also, we heard from Jim Leith. He is from the Baltimore Taxpayer Advocate, and he wanted to apologize. He knows that the Taxpayer Advocate program is really behind. Currently, they have 1,900 open cases, and they only have 12 advocates working in the office. This is huge. And he wanted to apologize, but he said they're doing everything they can to keep up. But he's asking that they asked us to be patient, and they're working very hard to achieve and get things done. But I can understand with 1,900 cases and 12 employees, it's got to be crazy at that office. And also, if you do have an issue, he said, hey, reach out to him and he will, see what he can do. And he could be reached at 443-853-5145. So, make sure, just be a little patient on this. I know a lot of people I've heard a lot of complaints from our members about this. So, but I didn't know the workload that they were under. And also, they stated about the retirement of Nina Olson. Now, Bridget Roberts is the acting national taxpayer advocate. And they just want a reminder that, if you do have some issues, back in July, IRS did pass a bill called the Taxpayer First Act of 2019. And if you are having some issues with, the issues with the IRS and how things are being handled, you might want to take a look at this. Actually, I had a conversation with a couple members the other day, and they brought attention because they were having issues. And you know what? If you look at that Taxpayer Act, you might see something in there that, might help you resolve the issue. So on Monday, a delegation of MSATP volunteers traveled to Annapolis to do some beta testing for the new website that the controller is rolling out. Now, it's supposed to be launched in mid-December. So, and I think they're really on target with this. The team at the controller's office did a great job on this site. And they really had a group of tax professionals in the room, and we were part of the third session. They had actually taxpayers there in the first session, vendors on the second session, and then they had the tax professionals on the third session. And we worked through and they navigated through the site for 2 hours. And I have to applaud the team. They were very open minded. They took our suggestions. And you know what? But, and on the foundation, they did a great job. It's very eye pleasing. And they're really keeping to the policy of the 3-click, that if the 3 clicks, if you're not there, you know what? You've given up. So they really focused on that as well. Well, Stephanie, all that I've just been talking away. Now I want to bring you on. So starting November 1st, all I hear about in the news about the new open season coming around. Mm-hmm. And so we are just in the midst of it right now. Or will be. So please explain to our audience, what is the Maryland Citizens Maryland Citizens Health Initiative?
Sure. So we're a consumer advocacy nonprofit. We've been around since 1999, and we work towards quality, affordable health care for all Marylanders. Our Maryland Healthcare for All Coalition is made up of hundreds of business, labor, faith, community, and health organizations from across the state. And yes, right now we're encouraging everyone who is uninsured in Maryland to go to marylandhealthconnection.gov for open enrollment. Open enrollment is from November 1st through December 15th. And the Maryland Health Connection is the state's online health insurance marketplace. Premiums are going down for the second year in a row. And 9 out of 10 Marylanders who go to Maryland Health Connection are eligible to receive financial help to get health coverage.
That's awesome. Now, I know you and I, not even really, you and a team of other professionals helped get a bill passed in 2018. Tell us a little bit about the goal of the bill and what the initiative is for the bill.
Sure. So there are a lot of people in Maryland who are uninsured who don't realize that they're actually eligible for free or low-cost health insurance through the Maryland Health Connection. And thanks to the Maryland Easy Enrollment Health Insurance Program, Maryland is going to be the first state in the entire country that is going to allow people to use their tax returns, their state tax returns, to start the process to enroll in health coverage and get that free or low-cost health insurance. We estimate that there's about 130,000 Marylanders who file state taxes and are eligible for free or low-cost health insurance, and they just may not even realize it. So the Maryland Easy Enrollment Health Insurance Program will not only help people get access to the health insurance that they need, but it's actually going to reduce healthcare costs for all of us. People without health insurance often go get their healthcare in the most expensive place possible, in the emergency department. That drives up uncompensated care. That drives up premiums for all of us. And so when more people get health insurance, uncompensated care goes down.
Ah, interesting. Now tell us a little bit how it's going to work. How is it going to work in Maryland?
So starting this tax season, on the 2019 tax forms 502 and 502B, filers will say whether they, their spouse, and their dependents have health insurance or not. Marylanders without health insurance can then elect to have the comptroller send their information from their tax return to the Maryland Health Connection to see if they're eligible for free or low-cost health insurance. The Maryland Health Connection will then mail a letter to the tax filer to let them know if they're eligible for coverage through the connection and if they qualify for free or low-cost health insurance. The taxpayer can then go to marylandhealthconnection.gov or call the Maryland Health Connection at 855-642-8572 to complete enrollment.
Wonderful. Now, I've spoken to a few of my members about this, and actually we've had a couple Facebook Live programs about this initiative and about the new changes on the Maryland 502. And some of our members have concerns, are they going to be penalized if they don't answer the questions? I mean, is it a requirement on that they answer the question on the tax return? I do not believe it is.
I would double check with the comptroller's office. I do not think that the comptroller's office would reject a tax return for not filling in this question.
Right.
But that said, I'm really thrilled that we already know that tax preparers make a big difference in people's lives.
Yeah.
And now they're going to have the opportunity to make a big difference in another way by connecting people with free or low-cost health coverage.
Now, you were just stating that the open enrollment is from November 1st to December 15th.
Mm-hmm.
Now, with this program, it's going to be, if they fill out the questions, this will be available till April 15th. Is
Mhm.
that correct?
Right. So we're encouraging all uninsured Marylanders to try to get in during open enrollment, which is starting November 1st through December 15th. We anticipate that there are probably some Marylanders who, even with all the advertising going on for
Mhm.
open enrollment, may not realize that they can get this coverage through the Maryland Health Connection. And for those people, when they make those selections on their tax returns to allow the comptroller to connect them with the Maryland Health Connection, they will get a special 30-day period
Right.
in order to enroll in health insurance if they qualify for what we call a qualified health program or private insurance. Folks who are eligible for Medicaid will be able to enroll all year round,
Ah,
but they still may not know that they're eligible for Medicaid, and so using their tax return will help them get that much needed information.
yeah. Now, so the tax returns are due April 15th, so they're going to get a 30-day extension um, to allow for that period for them to get signed up.
After they file their tax return.
After they file their
Right.
tax
From
return.
the date that they file their tax return, they'll have about 30 days to
Right.
sign up for private insurance. For Medicaid is anytime.
Right. But I think the important thing that we need to tell our viewers is the fact that April 15th is the last day. So if they have a client who's on extension, they won't
Right.
they will not qualify.
That is a great point.
Yeah, so
Mhm.
so we want to make sure they know that. So, if it's something that your client needs, you're going to try to get them to file that tax return by April 15th
Mhm.
because this opportunity will not be there after that.
Yes.
Okay, they will have to wait till the next open period, which will be next November 1st, 2020.
That's right.
Yeah, so I think that's a really good point. I think that's something that I learned recently in our last
Mhm.
meeting,
Mhm.
which I thought was very interesting. I think we need to bring home as well
Mhm.
because we do have a lot of people that go on extensions, and we want to make sure they know that that part of is not available after April 15th.
Right.
And so, from my understanding, is the controller's office is going to upload the information daily
Mhm.
to the exchange.
Right.
Okay, and so their client should receive some kind of communication within 30 days. Is that my understanding?
So after the comptroller sends the information to the Maryland Health Benefit Exchange or the Maryland Health Connection, the Maryland Health Connection will then, within a day or two, mail
Oh,
a
a day or
letter.
two.
Yep,
Wonderful.
they will mail a letter to the tax filer. They're not going to call. They're not going to email. They will mail a physical letter to the tax filer.
Wonderful.
And so by the time that the tax filer receives the notice, we think it'll be about 30 days.
Okay.
But there will be a date on the letter that
Okay.
the person should take note of.
Okay.
Mhm.
And then that letter will give them additional guidance on what steps they have to take or to get signed up.
That's right.
Yeah. So I think that's wonderful. And I think, the whole process is being very efficient. And I think the end user, who is the taxpayer, will find this information very useful. And I think, and one of the things I've learned since I've been on this workforce is that that the people can get the discounts or the money that's available to them will help lower the cost of the insurance, which
Mhm.
and there's a lot of opportunity there.
Definitely. About 130,000 could get free or very low cost health
Wow.
insurance and probably don't even realize it.
That's wonderful. So I thank you for the work you did with that.
And I want to thank you too for being on the advisory work group with me. That's the Maryland Health Benefit Exchange has an advisory work group to talk about this program. This is the first year pilot of the program.
Yes.
And we're working together to make sure that this works better and better each year and that it's going to be even more seamless for Marylanders to be able
Yeah.
to enroll in coverage using this program.
And one of the things I thought was really amazing, Stephanie, was what's comprised of the workforce. They really brought together the tax professional world, the associations, MACPA is part of it, the controller's office,
Mhm.
Care First. I mean, they really brought together a great team. And so they're really looking at even consumers,
Yeah.
the consumer groups.
Mhm.
So they're really looking at it in a completely and I really applaud the whole team that was put together. I think it's going to be a really great initiative. I think we're going to do a good job moving forward.
I think so too. And I know you're about to talk about the MSATP events.
Yes.
I'm really excited to have a table at all 4 of them, and I hope to see you there. I'm happy to talk with any of you about this program, and I'm just really excited about this new opportunity.
Yeah, because I think it's important that the information gets out there.
Mhm.
So we've extended inviting Stephanie to attend 4 of our events that are upcoming. The first one being next week in Frederick on November 6th. And then we have November 18th at Martin's Crosswinds in Greenbelt, December 6th at the Fontainebleau in Ocean City, and December 19th at Turf Valley Resort in Ellicott City. And not only, the reason why we picked those events is because those are where the controller's office is going to be doing their presentation. And they're going to be talking about this because of the changes to the 502. So it really is a great marriage that all of us can be working together on this. So I really appreciate that. And even if you're not attending these seminars, if you're in the area and you would like to get the information, I know Stephanie would enjoy talking with you. Just stop on by. Come on in. We have the exhibitors there. Stop on by and take the time to reach out to Stephanie, because even if you're not attending, she'll be happy to talk to you.
Yep, that's right.
That's wonderful. Well, thank you, Stephanie, for attending with us today and taking the time to join me this afternoon. I think it was really great information. And now, as we begin ending the phase 1, we're going to be starting to talk about the phase 2, which I think is really going to be exciting and some interesting work as well. So before I close out today, I just wanted to share a little story that was shared from my staff person yesterday. We had an event down in Gaithersburg. And, this really just shows to me how the community of our members and that attend our seminars are so passionate and work so closely together. We had one of our members actually get sick, and she was at the table, at lunch table, she got sick. And just one of our members sitting next to her said, you know what, I'm going to help you. And she took her to the emergency room. No questions asked, just stepped up and helped her out. And that just shows who our members are and what kind of community we have within this society. And I just want to say thank you to all of our members, because I think that is just amazing, today's world, that, we're able to do that. And we step in and we help each other with no questions asked. And I think that's just wonderful.
Great.
Yeah, I just wanted to share that little story because it did the heart good. Yeah, it really did.
Yeah.
And, so for those who will be joining us next week, we're going to be back at our normal time, Thursday, November 7th. Until then, have a great day. Enjoy this great weather.